Hello, I'm John Ball, Professor of Forestry at South Dakota State University, where I also serve as a campus arborist. One of my areas of research is tree worker safety, and anyone watching this doesn't have to be told that tree work is a high-risk profession. Right behind logging and commercial fisheries, every week we lose arborists while they're out working to a multitude of hazards. Either a tree falls on you, or a branch falls on you, or you're fed into a chip, or you're cut by a chainsaw, or you're electrocuted. And every week we lose even more people to serious injuries. Now, many of our serious injuries occur on the ground. You're either, again, struck by that tree or cut yourself with a saw, but the ones that are unique to our profession, the lonely ones, are the ones that occur when you're aloft. And that's where we need to have the aerial rescue skills. Aerial rescue has changed a lot in the last couple of years. We recognize that aerial rescues involve more than electrocutions. Aerial rescues involve more than just the quick, rapid descent of the victim to the ground. That we realize now that you can be struck by and hung up in a tree, that you can suffer serious injuries in a tree in which we don't want to move you rapidly. What you're about to see is a new approach to aerial rescue. Watch it carefully. We're going to go over the different types of aerial rescues that occur, and we're also going to look at the need to work closely with EMTs and other rescue personnel, because quite frankly, they're involved in most of the serious aerial rescues that occur in our country. So pay attention and be safe.
The following is a case study of an actual aerial rescue.
When I cut it, I cut 6.5 tendons across the top of my left hand here. The saw went in it. Just got complacent, I guess. Years and years and years of doing tree work. Never had an injury before, and it caught up with me.
All bound or something?
Yeah, when I cut my hand, I pretty much yelled down. Chris was on the ground, probably, I would say, 10 feet from the truck. So fortunately, he was right there, and he saw what happened. I think his calmness was what made the difference.
I've been working at Urban for about 6 years. When we're doing aerial rescue training, we usually start by watching videos again, just to kind of get an overall view. And then we have one truck set up in the yard as an example, and we usually have one crew kind of go over the aerial rescue, and then we try to get all the other crews to go and practice it basically until they feel comfortable. I happened to be working as a ground man that day, and I was watching the foreman work, and just waiting for an opportunity to go in and grab some brush to chip it up. And I just noticed one cut looked a little awkward, looked different, and I kind of knew something was wrong.
Our industry safety standard is the American National Standards Institute Z133. Prevent accidents by following ANSI Z133 safety standards and your company's safe work rules. It is your responsibility to know and comply with your company's policies, including all policies that outline aerial rescue procedures. If unsure, ask your supervisor. This is important because TCIA's Aerial Rescue Training Program presents a broad outline of aerial rescue procedures and techniques that may or may not be approved by your company. The following section outlines some safety standards that help prevent accidents. A visual hazard assessment, including a root collar inspection, shall be performed prior to climbing, entering, or performing any work in a tree.
Okay guys, we have this Acer macrophyllum here, big leaf maple. It's a nice old specimen. Obviously there's going to be some decays and rots in there. We're going to do a cleaning of this tree, 2 inches and greater. See this big snag up here? We're going to leave that. The client really likes that for wildlife habitat, so we're going to leave that in there.
A job briefing shall be performed by the arborist in charge before the start of each job. The briefing shall be communicated to all affected workers.
In here, I don't really see any poison oak or poison ivy. Obviously it was growing up the tree at one point. Doesn't seem to be any, but you know, let's just pay attention to that. Looking at the base of the tree, the roots look good. You know, there is a nice hollow pocket here. It looks sound. It's an old tree.
If you are not sure about a hazard assessment or don't understand a job briefing, do not proceed until you have informed your supervisor. Here is what a typical aerial rescue kit looks like. It should be tailored to the specific techniques and equipment used at your company. Job briefings should cover how an actual aerial rescue will be performed at the job site and where the aerial rescue kit will be located. The following are precautions you need to remember. The cardinal rule of aerial rescue is that a rescuer must not become a victim whether conducting an actual or practice aerial rescue. Use extreme caution. Any method outlined in the TCIA Aerial Rescue Training Program may result in injury or death to the rescuer and victim. The TCIA Aerial Rescue Training Program does not take precedence over CPR, first aid training, or other first responder training. There are a number of specific injuries that require you to take special precautions. A struck-by injury may pin a victim in the tree. A pinned victim may also have a puncture wound or back and neck injuries. If vital signs are stable, rule out impalement or spinal injury before attempting to move the victim. Wait until EMS arrives. Back and neck injuries can be caused by struck-bys, falls, and even electrical shocks. If the victim has stable vital signs, it is usually best to secure the victim in the tree, administer first aid, and await EMS. Lowering the victim immediately could make the injury worse or cause the victim to go into shock. Equipment in contact with a conductor must be considered energized. If equipment is energized, you could be shocked or electrocuted. Do not proceed. Do not attempt to access energized equipment. A danger from step potential may exist around energized outriggers as electrical current dissipates in the ground. Avoid step potential shock or electrocution by using shuffle steps to move away from energized objects. Suspension trauma can occur anytime a victim is suspended upright by their harness or saddle and are unable to move easily for a long period of time. If you cannot reach the victim, tell them to move their legs as if they are riding a bike to help pump blood until EMS arrives.
What? Pump my legs?
Some authorities recommend that the victim be rescued and transported with the upper body raised. They believe a sudden move to a horizontal position could cause shock or death. Be prepared for emergencies. Plan how you will handle an emergency before one occurs. Each crew member should know how to react. Be prepared by keeping an aerial rescue kit at the worksite. Place it away from the truck. Kits should contain a working cell phone, clean and dry throw line, clean and dry climbing line and climbing saddle, and positioning lanyards. Kits might also contain a set of climbers, sharp hand pruners or trauma shears, emergency phone numbers, and a first aid kit. Go over the work location with all crew members in the morning before you leave the shop. This way, if someone is not familiar with the location, you can still get directions before you leave.
Right there. It's south 12056 Southeast 115th Avenue, Clackamas, Oregon, right? Got the phone number and stuff here. Office knows we're going there.
Be prepared to call for help and give directions to the 911 operator. Make sure a working cell phone is at the job site and all crew members know where it is and how to use it. The results of many accidents were made much worse when crew members could not relay their specific locations to 911 operators. Tree workers need to be familiar with the climbing systems used at the company in order to perform an aerial rescue. Sometimes using a split tail system is a good compromise as the operation is easier for all crew members to understand. Prepare for an aerial rescue by installing a separate access line in hard-to-access trees. The climber may bring an additional line and install it in a location that has a clear path to ground. The access line may also be the ascent line the climber used to enter the tree. Climbers who use single rope technique may set a rescue pulley. Setting can be done from the ground. Climbers using SRT systems must be certain that crew members understand how the system works and can lower the pulley.
Okay. That's good. Oh, there she is. Right? I'm going to tie a slip knot underneath there. Okay. Backing it up with this. Okay. Sucking it down. So if, if I get hurt up there, I want you to unclip this, pull this out, and then you're going to run this. Okay? Okay.
The following section outlines techniques that might be used to reach and lower a victim. It is not intended to limit the methods in which a victim may be reached and lowered. See the ARTP workbook for a detailed comparison of lowering techniques. As you watch, remember, these rescuers are following the aerial rescue protocol and only lowering the victim for specific reasons. We will review the protocol later. If available, an aerial lift may be used to reach and lower the victim.
This is a good access line. I'm going to use it. So I'm coming to get you, Adam. I'm coming to get you. Coming? Okay. The ambulance is on its way, Adam. All right? Here we go. I'm coming to get you, bud.
A pre-installed access line may be used to climb to the victim. Equipment in the aerial rescue kit may be used to set a line and climb to the victim.
Pete! Pete! You okay? No. You awake? Yeah. Are you bleeding? I don't think so. Somebody call 911. Stand clear. Clear. Yep, there before you know it.
You may lower yourself on your climbing line while lowering the victim on the victim's climbing line. Attach lanyards between yourself and the victim. Lower by working both climbing hitches. To make this easier, you may attach a small pulley above the victim's hitch and connect it to your saddle. Let's look at that again. If you use the micro pulley, the length of the strap is crucial. If it is too long, you will not be able to reach the victim's hitch. If the victim's line is damaged, you can connect to each other by any of the support and positioning attachment points on your saddles using a carabiner, locking snap, or lanyard. Let's look at that again. Be careful not to use any of the accessory snaps or rings, as these are not rated for support.
There we go.
Be certain that you and the victim are secured before untying.
Adam, where you at? I don't see you. I hurt myself. I think I pulled something in my sternum or rib. I don't know. I need to come down. I'm hurting.
Lower the rescue pulley line if the victim has a clear path to the ground.
Something happened. I think once I get to the ground, I'll be all right to stand, but I come over top of you. Help me. I don't feel well at all.
You get yourself down.
No, I don't. I'm feeling dizzy.
A bucket operator can lower a victim by attaching a pulley above the victim's hitch and slowly lowering with the bucket controls.
I'm gonna bring you down with this pulley, Pete.
Okay.
Mag's coming down.
A bucket operator can lower a victim by bringing an arborist climbing line, tying in, and then climbing out of the bucket to use a climber's rescue method. An incapacitated bucket operator may be rescued by using the aerial lift's lower controls. Removing a victim from a bucket can be difficult. You'll need to assess the victim's condition first. Only remove the victim if they do not have stable vital signs, such as they are not breathing.
I'm going to demonstrate how difficult it is to try to get a body out of an aerial lift basket. In this instance, we have a rescue dummy that weighs about 175 pounds in the basket. We're making the assumption that we've done the assessment already and this person needs to be removed from the basket. Perhaps they're not breathing, their heart isn't beating. For some reason, we need to get them out. Otherwise, we would just wait till the paramedics came. But I will demonstrate how difficult it is to get a body out of a basket. In reality, what I would likely do in this situation, if there was especially if it was a heavier person, I couldn't get them out. I would come over, do my assessment, check. In this case, we'll say the person isn't breathing. I would go back to the lower controls and drive the basket into the ground, breaking the leveling cables and dumping the person out. This dummy, rescue dummy we have, is about 175 pounds, and you'll see it is a little difficult to get out. Put a little bigger person in here would make this a lot harder. So, assuming I need to get this person out, I'll go to make the first thing. I was unclip the lanyard. Try to get the person out without injuring them further. Support them by their shoulders and arms. And grab the belt.
The aerial rescue protocol is provided by the ANSI Z133 safety standard in Annex F. Follow the flowchart during aerial rescue practice to help you make good decisions. The protocol is not intended to take the place of or precedence over company safety policies, basic first aid CPR, and other first responder training and procedures. In the next section, we will show aerial rescue scenarios. Please follow along on a copy of the aerial rescue protocol or in the ANSI Z133 standard. First, we will show a complete sequence. Think about what you would do. Then we will show how the aerial rescue protocol may be applied to the scenario.
Tim, are you okay? Tim, talk to me. All right, I'll call for help.
Always be aware, a victim may not be able to call for help. Evaluate the situation. Is there an electrical hazard present? If there is not an electrical hazard present, call 911 or determine who is around to help make the call. If there is an electrical hazard present, call the utility system owner along with 911 EMS. Warning: cell phone calls to 911 often connect you to the state police in the area code where your cell phone is from. Usually they will not be able to contact the utility system owner. You may have to contact your supervisor in order to contact the utility. Most electrical hazard situations will require you to wait for EMS and the utility to make the area safe. Here's how the protocol addresses these types of hazards. Determine if the electrical hazard can be avoided, eliminated, or controlled. Warning: only the utility system owner can safely eliminate or control an electrical hazard. If the electrical hazard involves primary distribution voltages or greater, the answer will almost always be no, and you should wait for EMS and the utility system owner.
Adam, you okay? Are you okay? He's not responding. Call 911. You got that? Yes? Okay. There, I don't see any visible hazards up there. There's some hangers. There's a big cavity right there, a big graft. The crown looks good. Adam! He's not responding. Everything looks good. This is a good access line. I'm going to use it. So, I'm coming to get you, Adam. I'm coming to get you. Okay? Ambulance is coming? Okay. The ambulance is on its way, Adam. All right? Here we go. I'm coming to get you, bud. Adam, you okay? Are you okay? He's not responding. Call 911. You got that? Yes? Okay. There, I don't see any visible hazards up there. There's some hangers. There's a big cavity right there, a big graft. So the crown looks good.
Determine if the rescue can be done without any undue risk to the rescuer and others. If you cannot safely reach the victim, do not proceed. Secure the area and prepare for EMS.
Looks good. Adam! He's not responding.
Before proceeding, determine if the victim is conscious and responsive.
Everything looks good. This is a good access line. I'm going to use it. So, I'm coming to get you, Adam. I'm coming to get you. Okay? Ambulance is coming? Okay. The ambulance is on its way, Adam. All right? Here we go. I'm coming to get you, bud.
If the victim is responsive, ask the victim to help choose the best rescue method. If unconscious or not responsive, proceed with reaching the victim.
Adam, I'm almost there, buddy. He's still not responding. He's not responding. Still. Adam, you okay? His rope still looks good from up here. Adam? Adam? He's got a pulse, but he's not breathing. We got to do this quick. Someone on the ground, be ready whenever I come there to help me out. Okay? He's not breathing. Here we go, bud. Adam, I'm almost there, buddy. He's still not responding. He's not responding. Still. Adam, you okay? His rope still looks good from up here. Adam? Adam?
Once you reach the victim, check ABCs. Is the airway open and the victim is breathing and there is no severe bleeding and you can rule out suspension trauma?
He's got a pulse, but he's not breathing. We got to do this quick. Someone on the ground, be ready whenever I come there to help me out. Okay? He's not breathing. Here we go, bud.
If there is no breathing or no pulse, or there is severe bleeding or suspension trauma, lower the victim, even at the risk of aggravating other injuries. Perform CPR first aid immediately.
Go, bud. Adam, you okay?
No.
What happened?
It hurt my back.
What'd you do?
Oh, I swang, hit my back, my shoulder blade.
Adam's back is spasming. He hit his shoulder blade. I'm just gonna secure him here. I'm just gonna secure you, and then the EMTs are gonna come. Okay. Let's clip this here.
Careful.
Okay. Nice and tight. You okay?
No.
He's still not doing all right. Are the EMTs here yet? Is your ribs hurt? Can you breathe good?
Sort of.
Can you move your fingers? A little
Yes.
bit?